Can we start, Dr. Alex?
Yeah, please go ahead.
Yeah. Good evening and welcome to one and all.
Gauri is opened?
Yeah, I'm open. Yeah.
Okay, fine. We go ahead.
Yeah.
Good
So
evening and
it's open. Go ahead.
yeah. Good evening and welcome to one and all to the virtual release of the fourth edition of the book Communicate, Care, Cure, a guide to healthcare communication. Communication plays a crucial role in the medical field, ensuring patient safety, improving outcomes, and building trust between patients and the healthcare providers. Efficient communication between members of the healthcare team leads to better coordination and fewer medical errors, while effective patient communication enhances satisfaction, empowers patients in their own care, and improves adherence to treatment plan. With that, once again, a warm welcome to one and all. And I have the pleasure of welcoming Ms. Divya Alexander, editor and authors of one of the chapters of this book, to formally welcome everybody. Ms. Divya Alexander, please.
Thank you, Dr. VC. Good evening, everyone. My name is Divya Alexander. On behalf of my co-editor, Dr. Alexander Thomas, I welcome you all to the virtual launch of the fourth edition of Communicate, Care, Cure, a guide to healthcare communication. I would like to thank each one of you for making the time to attend and celebrate the launch of this book. We have many distinguished guests in our midst today. We are very pleased to welcome Dr. Vinod Paul, Member Niti Aayog, Dr. Abhijat Sheth, Chairman NMC, Dr. Shalini Rajneesh, IAS, Chief Secretary, Government of Karnataka, Lieutenant General Dr. Sadhna S. Nair, former Director General, Medical Services, Army, Dr. Devi Shetty, Chairman of Narayana Health, Dr. S.N. Basu, President of the Society for Communication in Healthcare, India, Dr. C.N. Manjunath, Lok Sabha MP, Dr. B.N. Gangadhar, former Director of NIMHANS and former Chair of the NMC, Dr. Vikram Matthews, Director of the CMC Vellore, and the eminent presidents and office bearers of AHPI, ANBAI, and CAHO. A very warm welcome to the distinguished members of the Editorial Advisory Board, Dr. Indu Arneja, Dr. Lalu Joseph, Dr. Sunil Khetarpal, and Dr. Atul Mohan Kochar. We extend a special welcome to the chapter authors, reviewers, and contributors who poured in their time, effort, and expertise into this book. We're so happy that you've joined us today. We welcome our colleagues and friends from institutional partners, AHPI, the Association of Healthcare Providers India, CAHO, the Consortium of Accredited Healthcare Organizations, the IIHC, the Indian Institute of Healthcare Communication, and BBH, the Bangalore Baptist Hospital. We welcome the team from South Shore Innovations Private Limited, our publishers, Juris Press, headed by Mr. Gauri Shankar Nathisan. We are grateful for your presence, healthcare professionals, educators, students, policymakers, colleagues, friends, well-wishers, and members of the public who understand the critical role of communication in healthcare. Thank you all once again for joining us at this virtual launch.
Thank you, Ms. Divya Alexander. May I now request the dignitaries to light the lamp and formally inaugurate this program. Thanking the dignitaries, I would now request Dr. Alexander Thomas, one of the editors and also an author of the book, to kindly tell us something about the book. Dr. Alexander Thomas, please.
Thank you, VC. Good evening, distinguished guests and dear friends. It gives me immense joy and also a deep sense of gratitude to stand before you today at the launch of this 4th edition of our communication book, Communicate, Care, Cure. When I look back, it is truly remarkable how something that began as a small initiative at the Bangalore Baptist Hospital has grown into a national movement, shaping how communication is understood, taught, and practiced in healthcare across our country. How did it all begin? When I took over as director of Baptist many years ago, we undertook a detailed analysis of the challenges we faced. And it very soon became clear that poor communication lay at the heart of many of them, among staff, between departments, with patients, and with all other stakeholders. Unfortunately, at that time, there was very little structured understanding of healthcare communication in India. So we reached out to Dr. Nagesh Rao. He was a health communication expert from the US, and he had just come back to India to head the Mudra Institute of Communications in Ahmedabad, a world-famous institute, is otherwise called as MICA. He and his team spent some time on the ground with us at BBH, and together we developed a standard operating procedure for communication. This proved so effective that we felt compelled to share it. And that, my friends, in many ways is how this book was born. The first edition was published in 2012, and it drew entirely from our lived experience at BBH with help from the team at Mudra, and it was truly a labor of love. Devi Shetty actually encouraged me to do this. This was my first venture into publishing and editing. We published and we actually distributed thousands of copies. We were the publishers. And this was at that time something unheard of for a professional healthcare book. It actually struck a chord across the country. Soon after that, in collaboration, once this book was done, there was a huge response. In collaboration with AHPI and CAHO, we began communication workshops nationwide, training hundreds of trainers and reaching thousands of healthcare professionals. This initiative went on to receive the Quality Council, the apex quality body. The Quality Council of India's the DL Shah Award, a very prestigious award, 2 years in a row, in 2013 and 2014. A particularly proud moment for all of us was when our Honorable Prime Minister sent a special medicine for the 3rd edition, recognizing the importance of effective communication in healthcare. And it was a great encouragement for us to continue this mission. Since then, and I think very importantly, communication has found its rightful place in healthcare policy and education. The NABH introduced it as a communication as a standard in 2014. The Medical Council of India, now the National Medical Commission, integrated into the undergraduate medical curriculum in 2019. At the same time that the National Board of Exams also introduced it in the postgraduate education. And it is now part of curriculum in all medical, nursing, and allied health curriculum. And my estimate is that 2 to 3 lakh students are exposed to this on a daily basis. Today, doctors and healthcare professionals trained in these principles are practicing across India. It has been used in major tertiary hospitals and also very small health centers. It's a trusted reference for both senior consultants, young interns, and students across the health sector. And I've got some limited feedback from patients who have interacted with patients who've actually undergone formal communication in their curriculum, that they feel more heard, more respected, and more involved in their care. And I believe that this will also reduce the number of incidents of violence against healthcare professionals in our country. And that, to me, is real impact. Now, why did we come out with the 4th edition so soon? The COVID-19 pandemic changed everything about how we communicate. Masks hid our smiles, touch was replaced by distance, and technology became our new bridge. But in all this, one truth remained: human connection is at the heart of healing. A kind word, a gentle tone, and an honest conversation. These were what sustained both patients and caregivers during those difficult years. And this fourth edition tries to capture these lessons. It reflects how communication must evolve, especially now in the age of digital health, yet reminds us, and I think this is important for all of us who work in the present day with technology, it reminds us that no technology can replace empathy, honesty, and the art of listening. No book of this kind is ever the work of one person. It's a result of collective wisdom, dedication, and teamwork. My heartfelt thanks to all our authors, reviewers, and contributors. A very special acknowledgement to the editorial advisory board who worked very hard. And this collective effort has turned a good book into a credible, contemporary, and enduring reference for healthcare professionals across the country. And I'm very grateful for the passion, patience, and the pursuit of excellence. As always in all my books, a very special word of thanks to Divya, who was crucial and pivotal in this. Her perseverance and meticulous coordination have been remarkable. And to our publishers, we have worked together in other books. This is the first edition of the communication care that they have done. They have ensured that the print version remains affordable. The previous edition, I think it was close to 600 rupees. We're very grateful to other publishers for making this available at 350 rupees. Our sincere gratitude and to them. This book is dedicated to all our patients and families, and that is what all of us in healthcare are there for. They remind us every day that communication is not just about words. It's about connection, it's about trust and shared humanity. To ensure access for all, this edition will be available free to download. There is a link for that. We will share it. And complimentary, as always, we will also distribute complimentary copies to our smaller hospitals. As was mentioned, as in the previous editions, this is a totally pro bono effort, and the royalties will, after expenses, will go to the Poor Patient Fund at Bangalore Baptist Hospital. This has been the practice for many years, and also to AHPI, supporting patients in need and strengthening our collective mission to improve care nationwide. So as we launch this fourth edition, I feel a deep sense of fulfillment and hope. So many people, so many of you have been part of this journey. This little book, as we fondly call it, born from experience and conviction, has grown into a movement that is transformative in Indian healthcare. And I must confess to you that when we started this, we had no idea that we'd be here today, and we're very grateful to God for this. To everyone, to all of you, and to many others who have been part of this journey, thank you for believing in the power of communication, for making it part of our professional identity, and for building a more compassionate, a more trustworthy healthcare system in our country, in our dear India. May it continue to remind us that how we communicate defines how we care. Thank you.
Thank you, Dr. Alexander Thomas, and with Ms. Divya and Dr. Alexander Thomas having given us an exposure about the book, let me now request the dignitaries to release the book I would like to personally thank all the dignitaries for having released the book, and this is the fourth edition of Communicate, Care, Cure, a guide to healthcare communication. With that, we move on to the next item in the program, addressed by the Editorial Advisory Board. I must make a mention that in this fourth edition, the entire contents have been restructured, the abstracts have been recreated, and the very meticulously finalized each chapter, and the credit for this goes to the editorial advisory board. And I have the pleasure of requesting Dr. Indu Arneja, founder director, Indian Institute of Healthcare Communication, to kindly address us, please.
You're muted. You're muted.
Thank you so much for informing me. Thank you. Thank you, Dr. VC, and good evening, everyone. It has been a truly enriching experience to contribute a chapter to this book on healthcare communication. As someone deeply engaged in this field, I found the process very intellectually stimulating and personally rewarding. Writing my chapter gave me an opportunity to reflect on how communication forms the very heart of quality healthcare, connecting not only just the doctors and patients, but also teams, systems, and outcomes. Serving on the editorial advisory committee added another layer of learning. Reading each chapter closely and exchanging ideas with the editors actually allowed me to appreciate the depth of thoughts and diversity of perspectives that have gone into this book. It was inspiring to see how each author brought unique insights and practical wisdom in the larger goal of improving patient care through effective communication. I think each chapter has been written in depth, in great detail, and with lot of wisdom. I would like to sincerely thank the editors, Dr. Alex and Divya, for all the effort they made to write this book, edit this book, and bring the ideas together, and for the vision, commitment, and meticulous effort in bringing this book together and on time. I think that's something I would really love to appreciate. Usually it takes much longer, and people who are writing or editing get discouraged when the book does not come on time. But you both have done an excellent job, and I think it's Divya behind the curtain who has been doing everything so well. So it's not easy to weave so many voices into one coherent volume, but they have done it very, very beautifully. I'm grateful for this opportunity to be part of the meaningful initiative and proud to see how this book will help build a more compassionate and communicative healthcare environment. Thank you once again for the opportunity. Thank you.
Thank you, madam. And now I request Dr. Atul Kochar, CEO of NABH, to kindly address us, please.
Thank you so much, sir. Respected seniors, Dr. Vinod Paul, sir, Dr. Shet, sir, Dr. Devi Shetty, sir, Dr. Alex, Divya, and all my distinguished colleagues and all the other seniors who are today part of the event. It's been a phenomenal learning experience. It's been a phenomenal, fantastic growth personally for me to be a small part of this venture. The fourth edition, I've been very familiar with the past three editions, but this edition includes all the cutting edge nuances which are required because of all the changes which Alex sir recently pointed out. NABH for the past 2 decades, and we feel very proud and privileged that we partner with more than 26,000 hospitals today, not only in India, but 12 countries. But communication forms the linchpin, the very pith, the very core of patient safety and healthcare quality. If there's something which can meaningfully change the outcome and positively change the outcome of a patient, and not only the patient, the entire families together, that is the communication. And this book touches not only those core areas, but everything around communication which makes it all worthwhile. I'm sure all those healthcare champions, quality champions, patient safety champions who are connected, millions of quality workers, healthcare workers, it's been written in such a simple, lucid, and very, very objective manner. They are all going to benefit. And I'm sure NABH and patient safety movement in the country is going to be stronger for such a simple yet comprehensive publication. Thank you so much to Alex sir and the entire team and the editorial board for making NABH and me a small part. It's been a great enriching experience, and I'm sure everyone will benefit from this. Thank you so much, and all of the very best to all the quality champions who are going to benefit from this. Thank you so much.
Thank you very much, sir. May I now request Dr. Lallu Joseph, Secretary General, CAHO, and Associate General Superintendent of CMC Vellore to address us, please.
Thank you, Dr. VC. Good evening, everyone. It's a privilege to be part of the editorial advisory board of the 4th edition of Communicate, Care and Cure, a book certainly that has transformed or truly shaped the way healthcare professionals think about communication. Over the years, this initiative has grown into a movement that reminds us that good communication is not an additional skill. It is at the very heart of quality care. It defines trust, empathy, and safety in every patient encounter. And I think it is important at this point to acknowledge the contributions of Dr. Alexander Thomas for bringing this communication to the center, to the heart of patient-doctor interaction. And really amazing work he has done through all the 3 editions. And it's a privilege to be part of the 4th edition along with Divya, to be working so meticulously. It's been a great learning experience. As Dr. Indu said, going through every chapter, and it's an amazing learning experience. It's not easy working with timelines with such busy schedule for all of us, but we, Dr. Alexander Thomas and Divya made it happen. Gentle reminders, amazing work done by all the authors. It really helped us to maintain the timelines, and thank you very much for teaching us time management. This new edition has beautifully captured the changing landscape of healthcare, from inclusivity and health literacy to the growing role of digital communication, reflecting how our profession continues to evolve with society. My heartfelt thanks and congratulations once again on behalf of CAHO and the governing committee of CAHO, the patrons, to Dr. Alexander Thomas, Divya Alexander, and the teams from HPI, CAHO, Bangalore Baptist Hospital, and the Institute of Healthcare Communication for carrying this vision forward. May this edition continue to inspire us to communicate better, care deeper, and heal stronger. Once again, thank you so much for this wonderful opportunity. Best wishes, and I'm sure our readers are going to have a wonderful experience reading this amazing book. Thank you.
Thank you very much, madam. May I now request Dr. Sunil Ketrapal, Deputy Director General of AHPI, to kindly address us, please.
Thank you, Dr. VC. Good evening, everyone. It's a privilege to be part of this special moment, the launch of the 4th edition of Communication, Care, Cure. My heartfelt congratulations to Dr. Alex, Thomas, Divya, and the entire team for bringing this important work of life once again. This book has always stood out for its simple yet profound message that how we communicate is just as vital as what we communicate. In healthcare, every word, every gesture, every pause has the power to heal, to comfort, and to build trust. Over the years, communication, care, cure has continued to evolve with each edition, as mentioned by our previous speakers, and enriched by the valuable updates, evidence, and practical insights from the authors. This continuous refinement reflects a deep commitment to supporting healthcare professionals in delivering compassionate and effective care. Reviewing this latest edition, that is the fourth edition, has been a great learning experience for me personally. A reminder that communication is a lifelong skill. At its core, this book reinforces the compassion and clarity are not merely soft skills, they are clinical competencies. So even as technology advances and digital transformation accelerates, the human touch remains irreplaceable. For me, this book is more than a guide. It is an invitation to listen deeply, to speak loudly, and to care wholly. I hope it continues to inspire professionals across the healthcare spectrum to practice medicine not only with their technical competency or skills, but with empathy and heart. So, thank you for allowing me to be part of this meaningful journey. My warmest wishes for the continued success of this remarkable initiative. Thank you so much.
Thank you, Dr. Sunil Ketrapal. With now, we move on to acknowledging the editors, the editorial advisory board, the authors, and the publishers, for which we have an exciting short video. Thank you very much, and special thanks to Mr. Deepak for the captivating music. We now move on to address by the guests of honor. We have a good number of distinguished guests amidst us. May I now request Lieutenant General Dr. Sadhana S. Nair, retired, former Director General Medical Services, Army. And she is the first woman Director General who has been a steadfast supporter of all our initiatives, especially in advancing skills and training healthcare professionals from the day one of our journey. It's a great pleasure to request Dr. Sadhna Nair to address us. Please.
Thank you very much. It's a real honor to be present here at the virtual release of the fourth edition of this book, Communicate, Care, and Cure, A Guide to Healthcare Communication. And especially in the esteemed presence of the guests of honor, Dr. Vinod Paul, member of the Niti Aayog, Dr. Abhijat Sheth, the chair of the NMC, Dr. Shalini Rajneesh, Chief Secretary, Government of Karnataka, Dr. Devi Shetty, Chairman, Narayana Health, and all other luminaries who are present here today and who have contributed so actively, not only in the editorial board, but as authors and as reviewers for this exceptional book on healthcare communication. A very special thanks to Dr. Alexander Thomas and Divya Alexander, because of whom I'm present here today. My association with them began more than a decade back, and it's a real privilege to be present here today. If you look at human beings, they inhabited this planet about a few million years back. And human communication actually, in fact, first began with gestures and facial expressions. And vocalizations or some form of language started as long back as 100,000 years. And in fact, it was in 9000 BC when humans, Homo sapiens, started using pictograms or symbols to represent objects and ideas. If you look at it, actually, I think we're coming back full circle, because if you see the emojis which we use are similar to the pictograms, perhaps, which were used in 9000 BC. Written communications like using hieroglyphics and all started in 3500 years before Christ. And we have evolved a long way since then, using both verbal as well as non-verbal communication, as was used by our ancestors to communicate. We know that communication is especially important in healthcare because it ensures that accurate information exchange is there between the providers, the healthcare professionals, patients, and their families. And this is extremely essential for delivering high quality care. It is very essential for coordination between the healthcare teams, especially when we are living in a world of specialization and super specialization, where everyone is working in their respective silos. So it's very important that there is communication between these silos. All this results in reduction in medical errors. There is improvement in patient outcomes and improvement in patient safety. There is enhanced patient satisfaction, and good communication encourages active participation by the patients themselves in their own care. I think a number of us would have read that very famous book, When Breath Becomes Air, by Dr. Paul Kalanity, an American of Indian origin, a neurosurgeon who found that he had a stage 4 brain cancer in his final year of residency. And it is mentioned of this book in a review that while medicine has its limitations, there is no limit to human empathy, compassion, care, and love. And I think effective communication is an arrow which provides all this, and it results in hitting the target in the bull's eye so that the maximum impact of healthcare delivery results. So remember, to conclude, that I would like to say that we must remember that if you communicate in a normal way, you can get by. But if you communicate skillfully, we can actually work miracles. Thank you once again for permitting me to be a part of this extremely valuable occasion where we could get to see this online release of this extremely important book. Thank you once again to Dr. Alexander and his team. Jai Hind.
Thank you very much, madam. May I now request Dr. Devi Shetty, the chairman of Narayana Health, who has been kind enough to pen the foreword for this edition. Dr. Devi Shetty, please. Sir,
Thank you so much. First of all, I want to congratulate Alex for writing a book on healthcare communication. I'm very closely involved with medical education for quite some time. That is something which is close to my heart. And today, medical science has progressed significantly. And medical education also has progressed significantly. But the art of communication is really not taught in most of the medical colleges, not only in India, across the world. Because we believe that medical science is more important than communication. But I have a different view. I'm one of the old-time doctors. For me, communication is as important as the medical care. And I make it a point with every patient. First thing is, even though I have all the diagnostic tools with all the reports in my hand, I will still insist on examining the patient. In the process, touching the patient and looking at their eyes and taking the history, talking to them and explaining to them in detail. I always have a model of the heart in front of me. And I explain to each and every patient what coronary artery is, what the valve is, how does it function, before I talk to them about the disease. And this is extremely, extremely important, irrespective of how technologically we will be superior to our older generation of the doctors. Art of communication, compassion will always remain as the mainstay of healthcare. I'm extremely grateful to Alex and his team for writing this great book, and I hope it will become part of the curriculum for the medical students across the world. Good luck and God bless.
Thank you very much, sir. Very kind of you for those wonderful words. I now request Dr. Abhijat Sheth, Chairman, National Medical Commission and President of NBEMS. He has been a reformer who has brought transformative changes in medical education. Requesting Dr. Abhijat Sheth.
Namaste and very good evening to all the dignitaries. First of all, now on behalf of the National Medical Commission, I extend my gratitude to Dr. Alexander Thomas and the team. Second, my heartfelt congratulations to Dr. Alex Thomas, Dr. Lallu Joseph, Dr. Atul Kochar, and all the associates who is continuously evolving this art of communication. And I feel that this is the need for an hour. And in fact, recently, when I was with the ECFMG chief, and last year also, they are going to include communication as an essential skill in the medicine. And possibly this will be reflecting in the coming USMLE examination assessment also. So communication is so vital. Communication is not only about speaking the language, but you need to develop insight. Over the time, I also learned a lot of things about communication, and I learned that even silence is also one of the languages and when required. So communication has a huge spectrum and scope. And when this insight develops along with the language, certainly it will help the medical profession to convert from knowledge to the best practices. At National Board of Examination, I compliment Dr. Alexander Thomas, as well as our lead communication uh, member, board member, Dr. Sista Basu, who just recently published a book on the communication. And they have continued the efforts to expand the communication teaching across the institution nationally. And I would urge that let us continue our effort to get the communication skills better and better with our coming generation. And I ensure from the council that we will provide all possible support to extend this novel education to our students that will make them a great doctor of the next generation. With that, my best wishes to all of you, and thank you so much.
Thank you very much, sir. May I now request Dr. Shalini Rajneesh, IAS Chief Secretary, Government of Karnataka. She has been consistently supportive of all of our efforts and has guided us from the policy front. A senior governmental leader, Dr. Shalini Rajneesh. Well, I think there is some technical problem. We move on to address by Dr. Vinod Paul, Member Health, Niti Aayog. And he has been a strong pillar of support in all our efforts for better healthcare and community well-being. Dr. Vinod Paul, please.
Good evening. Namaskar. I am truly honored to be a part of this celebration of the launch of Communicate Care Cure, of which we are going forward with the fourth edition. Fourth edition itself is a landmark achievement, landmark recognition. As we heard our esteemed speakers, communication is a core and a non-negotiable skill required by and to be practiced by all health professionals, doctors, nurses, and our distinguished allied professionals. In fact, for medical education and medical practice, or health professional education and health practice, there are three pillars, three legs. And these three domains are the knowledge domain, psychomotor skills domain, and the communication domain. Each one of them are equally important. Equally important. Knowledge alone is not enough. We should be able to perform skills. And both of these are incomplete without empathetic communication built on trust and built on core human value and feel. Communication is the bridge between scientific knowledge and the mind and the heart and the brain of the physician with the patient and the patient care. It is so important. And indeed, as has been pointed out, we had assumed that communication skills get built up watching our role models in the course of our training. But there are systematic ways of imparting the skill, and indeed, there are systematic ways to learn and self and practice. All healthcare providers should have the ability to listen with them. We all know. And to be able to explain with empathy, and to be able to connect and engage with the families and the patients themselves in the spirit of true trust. Good communication not only builds a trust, but it also, as we have heard, actually improves health outcomes with patient compliance, with improved patient safety, by reducing the risk of miscommunication or inadequate communication or improper communication or quite often delayed communication. It's about improving quality of care, and it's about truly improving health outcomes, as I mentioned. And I'm so happy that NABH considers communication theme to be an important area to be ensured as a part of an MBH accreditation. And I'm also very delighted to hear my distinguished colleague, Dr. Abhijat Shetji, giving a new emphasis, renewed emphasis, and a vibrant support to promoting communication through medical education, of which he is now our general leading us all. Human connection is, after all, about being, being a part of a patient's family, and human connection is the very soul of healing and health. And very rightly so, when communication is practiced, good communication is practiced, it gives us extremely useful and very proud dividends in the form of enhanced patient satisfaction and enhanced patient gratitude. These are priceless gains for any healthcare provider. The trust of the patient, respect of the patient, satisfaction of the patient, and the gratitude of the patient. The key to that, apart from being a good clinical doctor, a clinical decision maker, is good communication, which really touches the heart and, of course, the mind of the family and the patient. The book, having gone into the 4th edition, clearly has stood the test of time, and it is a testimony that the content of the book touch the lives of patients through the providers. I really, truly, and generously like to congratulate the authors, the editorial board, the publishers, and indeed all the supporters of this initiative that has been led so aptly and so passionately by Dr. Alex Thomas. It is an act of seva and samarpan, and I'm so happy to be a part of this very heartwarming event and a milestone in the journey of this book, and the journey of the hard work and value-based effort that has been lent by the entire team that has brought this book to this stage. And I see a great future for the book. And as we heard, it should be a part of very visible curriculum, visible resource for our young doctors, for our residents, as well as even senior teachers. I would hope that in due course, we can back it up with videos and other resource materials that can help the penetration of the messages, the imbibing of the messages even more effective. But today, I salute the entire crew that has created this book and taken it to the 4th edition. We are very happy to be here. Congratulations and thank you. Jai Hind.
Thank you very much, sir. Let me see whether I can connect with Dr. Shalini Rajneesh, please. Dr. Shalini, madam? Yeah, we'll move on with the address by the publishers, Mr. Gauri Shankar Natesan, CEO of South Shore Innovations Private Limited. Mr. Gauri Shankar, please.
Thank you. distinguished guests, panelists, and those who are participating in the event outside this Zoom panel. It is my privilege to welcome all of you to this book launch on behalf of South Shore Innovations. And thank you for taking the time to be here today. My team and I have worked with Dr. Alex Thomas and his team over several years, and I extend my heartfelt thanks to them for the opportunity to collaborate on this important publication. As publishers, it is our role to produce, promote books, and those that meet a range of criteria: topic, relevance, author credibility, marketability, and those are things that we look forward to on a day-on-day basis. Occasionally, we get a book that kind of stands apart, and where it is more than just a book, it becomes more in terms of what we can do for a segment. In this case, the medical profession. So, Communicate, Care, Cure: A Guide to Healthcare Communication is one such title. And this volume brings together contributions from professionals who highlight the critical importance of clear, confident, and compassionate communication in healthcare. So its relevance in today's context, it made it a very easy decision for us to partner with Dr. Alex when he reached out to us and his entire team. So we published this book under our imprint, Juris Press. When we committed to publishing, and when I had my first discussions with Dr. Alex, what was very important was the timeline. And I'm glad that we were able to meet those timelines. And I would like to take this opportunity to thank my team for their dedication and expertise, which ensured that the book was delivered on time and to the quality standards that we committed to. At the same time, without the support of Dr. Alex, Divya, and the team, and Dr. Alex's team, it actually ensured seamless collaboration. Very rarely does it happen in publishing where both sides work at the same speed. Somebody made a mention about publishers not publishing in time, and therefore the author losing interest is very, very, very critical. And in this case, it just so happened that both sides worked at the same pace and very seamlessly. So I'm very thankful to the HPI team and Dr. Alex for that. I'm sure this book will be well received. It is, as I speak, it is available on Amazon India. And we also have put it through our own ebook store, Book Central. And I think, as Dr. Alex mentioned earlier, it is an open access book, and the version is also available. And the links to all the formats will be shared later during this event. So once again, thank you very much for the opportunity to be here and participate in this launch, which is very important to me, my company, and my team. Thank you.
Thank you, Mr. Gauri Shankar Natesan. With that, we move on to the messages section. Actually, our Honorable Minister for Health and Family Welfare, Government of India, Mr. J.P. Nadda, is to have sent a message. As he is busy with the elections, he is unable to do so. And we also have a message from the Honorable Prime Minister of India, Shri Narendra Modi. As per protocol, the Prime Minister's office will give a message only after the book has been released. Therefore, it's my privilege to present to you the message received from our Honorable Prime Minister on the release of the third edition of this very book. Now, to present the message, quote, "It is heartening to learn that Association of Healthcare Providers India is releasing the third edition of the book Communicate, Care, Cure, a guide to healthcare communication. Our government has been striving relentlessly to give a new direction to healthcare and make it affordable for the poor, needy, and disadvantaged sections of the society. A healthy citizen, a healthy family, and healthy society are the bedrock of a healthy nation. We are firmly committed to strengthen the health infrastructure in big cities and upscale healthcare facilities in smaller cities. Medical professionals and experts should always strive to sharpen their communication skills to convey the benefits of keeping healthy, efficiently, as well as compassionately. Communication with sensitivity is integral and critical to help the common man understand various complex issues related to the diseases and treatment. Also, the need of the hour for the medical fraternity is to carry out extensive research and think out of the box to make available treatment and cures that arise out of nature. The publication being brought out will serve as a bridge between the medical professionals and the common people. May the book guide the common people to embrace a healthy way of life that promotes good physical and mental health and well-being. I wish the publication of the third edition of the book, Communicate, Care, Cure, a guide to healthcare communication, all success, unquote, Narendra Modi. Now, this book, as has been mentioned by Mr. Gauri Shankar Natesan, is available as open access, can be purchased online on Amazon India and Books Central. With that, we move on to the vote of thanks to be rendered by Dr. M.I. Sahadullah, National President, Association of Healthcare Providers, India. Dr. Sahadullah, sir.
VC, can you hear me?
Yes, sir. Please go ahead.
Yeah, thank you, VC, and good evening to everyone, all the distinguished guests. It's a pleasure to be, with all of you. I heard a lot about the communication importance, and that is really heartening because that's a real problem for healthcare delivery today all over India. So I bought many books, many copies from Dr. Alexander, and distributed to my doctors in our hospital. So first of all, let me congratulate Dr. Alexander and Divya Alexander and the other editors, Dr. Atul Kochar and Dr. Lalu and Dr. Sunil Ketapal for coming out with such a the fourth edition. And I'm sure I've already ordered copies for my doctors. The only one thing, when there are many policy makers are there, I think, like Dr. Abhijit told us, it is very important to make not only in the medical education, but also in the examinations as Royal College of Physicians and Royal Colleges do. It's a station, there's a station for testing the communication skills, and that has a compulsory pass mark. And I think NMC, I hope, will adopt similar methodology. And again, I congratulate all the editors, advisory board, authors, publishers, and also the guest of honor, Dr. Vinod Paul, Dr. Devi Shetty, Dr. Abhijit Sheth, and Lieutenant General Satana Nair. A special mention to all the organizations who have supported this endeavor, and the AHPI leadership and secretariat also were very much involved in it. I'm very happy that we could support Dr. Alex and team in a small way. And certainly, I will be failing in my duty if I don't thank the master of ceremony, VC Shanmuganathan. We are also delighted to announce the book is freely available now, as the publisher said that in Amazon it's already available. Thank you very much. Have a good evening. Jai Hind.
Thank you very much. With this, we bring down the curtains on this virtual release of the fourth edition of the book. Thank you very much, please.
Yeah.
Thank you.
Thank you, everybody.
Thank you. Thank you and congratulations.
Thank you. Thank you.
Thank you.
Thank you.
Thank you and congratulations, sir.